I'm Brandon. I'm going to be a physician assistant student for today. I'm going to be going over your general vitals, head, ears, eyes, nose, and throat exam. I'm going to ask you please take off your shirt, socks, and shoes when I go down and get started with the exam, okay?
Okay.
I'm going to wash my hands. Thank you. Okay. So the first thing I'm going to notice is your appearance and general health. I'm going to note that your stated age relates to your correlated age. I'm going to note your body hygiene and any breath and odors. I'm going to note your body habitus and any physical deformities, as well as your posture and your motor activity. I'm going to notice your facial expressions for any sign of pain or discomfort. And at this time, I'm going to take a mental health exam. This time, I'm going to take your height and weight. This time, I'm going to take your oral temperature, okay? I'm going to place this under your tongue. Just open your mouth, please. Hold it there until it beeps or for 1 minute. Okay? Okay, next I'm going to be taking your pulse. I'm going to take the radial pulse and palpate with the tips of my middle and index fingers. And I'm going to count for 15 seconds, noting your rate, rhythm, amplitude, and I'm going to multiply the number by 4. At the same time, following this, I'm going to take your rate of respiration, and I'm going to count the rate and depth of your chest, multiplying by 4 after 15 seconds as well. Next, I'm going to move on to take your blood pressure. So the first thing I'm going to do is make sure that the width of the bladder is 40% of your arm circumference, which it is. And I'm going to make sure the length of the bladder is 80% of your arm circumference. I'm going to palpate for your vertical pulse. Right now I'm going to place the blood pressure cuff 2.5 centimeters above your anterior fossa, or 1 inch above. I'm going to take your radial systolic pressure. I'm going to count to which the pressure is that your radial pulse stops beating. Okay? Now I'm going to inflate the cuff, and I'm going to wait 30 seconds, 15 to 30 seconds. The next time I'm going to reinflate the cuff 30 millimeters above where your radial systolic pressure was, RMS. And I'm going to listen for the first quarter cough sound as I decrease the pressure at 2 to 3 millimeters of mercury per second. The first quarter cough sound is going to signify the median your systolic pressure, and the cessation of the quarter cough sound is going to signify the diastolic pressure. Okay. And if needed, I will do the blood pressure and the seated in supine position after I do your other arm as well. to your skin exam. We're going to inspect your skin pigmentation and look for any rashes, masses, or lesions. Okay, I'm going to please ask that you stand up. I'm just going to inspect. Can I have you pull your shorts up a little bit for me? Okay. I'm just going to have you turn around, please. Okay. Can you pull the back of your shorts up for me, please? Okay. Next, have you pick up the bottom of your feet really quick for me, please. Pick the bottom. Okay, the other foot now, please. Awesome. Okay. You can have a seat again. Now, I'm going to palpate your skin for temperature, moisture, and texture, as well as mobility and tremor, okay? Next, I'm going to inspect your fingernails and toenails for any cyanosis, brutalis, lesion lines, or clubbing. Okay. Inspect your toenails. Okay. Next, I'm going to move on to your head exam. And first, we're going to inspect your head to make sure it's in the proper position, shape, size, symmetry, contour, and no deformities. Next, I'm going to inspect your scalp. I'm going to be looking for any hair growth patterns, hair texture, lesions, nits, lice, or any dandruff, which is all good. Okay. Next, I'm going to inspect your face to make sure there's no lesions, lumps, bumps, or any hair growths or lesions, which looks good. Next, I am going to go back and I'm now going to palpate your scalp. I'm going to palpate your scalp for any tenderness, any lesions, or again, bumps or any deformities like that or contour. Okay, which is good. Next, I'm going to palpate your scalp for mobility and tenderness. Okay. And next, I'm going to palpate your temporal arteries. I'm noting for pulsations and tenderness, and move down to your temporomandibular joint. And we'll look for any tenderness, cartilage, or deformities. And then you open your mouth, please, side to side, and forward and back. Okay, awesome. Now I'm going to palpate your parietal glands for any swelling or tenderness. This looks good. And now I'm going to move to your forehead, palpate your forehead. Make sure the orbital arch is lymphoma. Your submandibular area and your submental area for any tenderness, which is good. Okay. Next, I'm going to move on to your eyes. Examining your eyebrows, eyelashes, and eyelids for any arrhythmia, lesions, or edema. And then also note the position and closure of your eyelids. And now I'm going to move on and look at your lacrimal ducts and glands. And I'm going to make sure that there's no inflammation or lesions. I'm going to ask you to close your eyes, please. I'm just going to palpate for any tenderness there. And I'm also going to palpate the nasociliary duct for any discharge or anything like that. Okay, you can open your eyes again. I'm now going to look at your cornea, your palpebral and bulbar cornea. I'm going to make sure that there's no blood or any injection in there, as well as any lesions, which is good. Okay, now I'm going to inspect your sclera. I'm going to ask you to open your eyes, just look up for me. Look down. Okay, I was suspecting for any injection of blood in the color of the sclera. Next, I'm going to move on and test your visual acuity. So what I'm going to do is just ask you to please hold this card out as far as you can and cover your left eye. And then I'm just going to ask you to read the smallest row that you can from that column.
3745.
Okay. Now the same thing with the other eye. Goes that way. Read the smallest from this column.
95623.
Okay. And now with both eyes.
525983.
Okay. So I will do this with and without contact lenses or glasses if you have any. Okay. But now I'm just going to measure your pupil size. 3 on that one. are symmetrical, that's good. Okay, next, I'm just gonna shine a light in your eyes, I can pupillary reflexes, okay? Okay, awesome. Next, I'm gonna test your gross confrontation. What I'm gonna do is have you put your hands up just like this for me. And then I'm going to move from the back of your head into your field of vision in 3 different directions, from above, the sides, and below. And when I get into your field of vision, I just want you to point at my hands, okay? Okay. Okay, awesome. Okay, you can put your hands down. Okay. Next, I'm just going to ask you to look at this pen light. I'm going to do another test. I'm just going to move it in a couple directions. I just want you to keep your head still and just move your eyes and follow the light, okay? Okay, awesome. Next, I'm going to test your accommodation and your convergence. What I'm going to do here is an accommodation. I'm going to just ask you to stare at the blank space on the wall behind me. I'm going to move this pen light into your field of view, and I just want you to look at the pen light for me when I move it in the field of view, okay? Ready? Okay. Next, I'm going to test your convergence. I'm just going to move this pen toward your face, and again, I just want you to follow the pen through with your eyes, okay? Okay, great. Last, I'm going to test your eyelid, your lid lag. I'm just going to ask that you follow this pen again with your eyes. So I'm going to make your eyelids. Okay, great. Okay. Next, what I'm going to do is I'm going to use tangential lighting to look into your cornea and then into your chamber of your eye. I'm going to shine a light from the side of the eye, just making sure that there's no crescent shadowing in the middle portion of your eye, okay? Okay, next I'm going to use direct and consensual lighting to test your pupillary reflexes, okay? I'm just going to use the back of my hand, cover one side of your nose just so the light can't get to the other eye. I'm just going to shine it and look at both eyes. Same thing on the other side, okay? I'm just going to look at your corneal light reflex for symmetry. I'm just going to ask that you look at a fixed position on the wall behind me. I'm just going to shine a light in your eyes, okay? Awesome. Next, I'm going to look at your red light reflection in your optic disc. I'm going to look at the margins as well as the cut to disc ratio and the retinal veins, arteries, and the condition of the retina itself. So what I'm going to do is I'm going to be about 15 inches from your face. I'm going to hold your eye open with my hand, and I'm going to slowly move in from a 15-degree angle with the side. And when I get close enough, I'm going to ask you to please look into the light so I can assess your photo and walk in, okay? I'm going to start from this side, okay? Okay, look at the light. Alright. And do it from the other side. Okay, look at the light. Okay, awesome. Thank you. Okay. I'm just going to turn the lights back on. Okay, now I'm going to do your ear examination. I'm going to start off by looking at the auricle of your ear. I'm just going to look at any masses, lesions, or any inflammation, okay? And the discharge. Now I'm going to palpate for tenderness, both auricles, both tragus, and both of the mastoid processes. Okay. Now I'm going to perform the whisper test. I'm just going to close one ear, get an arm length away. It's for a 2-syllable word. I just want you to repeat the word back to me, okay?
Baseball.
Right.
Football.
Cool. Okay, next I'm going to just do an internal actually, examination of your ear using this here. Just going to pop my fingers up in your head so if you move, it doesn't hurt you. Just going to pull your auricle up and back, and just going to look in your ear at the external canal, noting any earwax, any inflammation, edema, or any foreign bodies. Look a little further in your ear, pin membrane, and look at the malleus on this internal leg. Good. Okay, that's good. Okay, great, good. Okay. Next, I'm going to move on to your nose exam. Okay, I'm just going to test your nasal patency. I just want you to close one nostril and breathe in deeply for me. Okay, and the same thing with the other one. Okay, good. Okay. Next, I'm just going to take a look into your nose really quickly. Actually, before I do that, I'm just going to palpate you really quick. Is there any tenderness? Palpate your maxillary sinus as well. There's your frontal sinus, all good. And now I'm just going to take a look inside your nose at the nasal mucosa. Look for any polyps. And I'm also just going to look at your sinus, or your nasal septum for any deviation or perforations. Okay. Okay. Next, I'm going to move on and do the oral examination. I'm going to do here, so I'm going to use this and my pen light. I'm just going to look into your mouth, noting your nasolabial folds, buccal mucosa, your teeth, your tongue, your gingiva, lower mouth, and lips. Okay. I'm going to note for any inflammation, edema, in the state of your teeth. Okay. Good. Okay. Now I'm going to look into the back of your throat. I'm going to look at the left posterior pharynx and your uvula. So actually say ah. Okay. And then actually stick your tongue out for me. Okay. Actually you say because I want to look at the sonification and the symmetrical lines of your uvula and your palate. And then say to which one's the midline protruding of your tongue, as well as the color and the texture. Okay. Next, I'm going to just examine your tongue really quick. I'm just going to ask you to stick it out for me. And then in doing that, I'm just going to palpate for any undulation or anything like that, any masses. Okay. Stick that up for me. Now we're going to move on to your throat exam. So look at your throat, make sure it's midline, make sure that there is no masses, thyroid or jugular venous distension, which looks good. And now I'm going to move on to your thyroid exam with palpate and make sure that there is no masses or bumps in your thyroid. So what I'm going to do is I'm going to get behind you and I am going to palpate here. I'm going to displace your trachea slightly. It might be uncomfortable, but it just allows me to get a better feel of your thyroid gland. And I'm just going to please actually swallow for me? Okay. Face the other way, swallow again. Okay. And one more time, swallow for me. Okay, great. Lastly, I'm just going to palpate your lymph nodes. I'll be done with the exam, okay? So, I'm just going to palpate your periradial lymph nodes, post-radial lymph nodes, your occipital lymph nodes, and move to your tonsil lymph nodes, submandibular lymph nodes, submental lymph nodes, anterior chain lymph nodes in the neck, posterior chain lymph nodes in the neck. And let's check your deep cervical lymph nodes. Just gonna ask you to bend your neck to one side. Okay, this side. Bend this way, all the way that way, okay. Okay, bend the other one now. Okay, and last thing, I'm just gonna check your supraclavicular lymph nodes. Deep breath for me, please. Alright, that's examination.